Your future, your choice. At TFP Fertility, we believe everyone should have the option to choose when they start a family.
So egg freezing is a method of preserving eggs for future use.
The process itself is quite straightforward and the nursing team are on hand to advise.
We would aim to freeze all the mature eggs that a patient had.
It is a very valuable option for everyone, no matter where you are in your life.
Egg freezing gives you the freedom to focus on what matters most right now, without sacrificing a family later on.
If people want to delay parenthood, they can freeze their eggs at a younger age, because unfortunately female fertility does decline with age.
Our job is to guide them and support them throughout.
Egg freezing is a safe, effective and proactive way to preserve your fertility. Whether you're focused on your career, exploring new possibilities, or simply not ready for parenthood, it gives you peace of mind and control over your timeline.
Legally, eggs can remain in storage for 55 years from the date they were frozen, and they're there for when you need them.
By tailoring the treatment to the individual, hopefully we will minimise any of the risks that are inherent with an IVF procedure.
With over 35 years of expertise, TFP Fertility offers compassionate, patient-centred care across our 8 treatment clinics in the UK. We combine world-class science with warmth and empathy to guide you on your egg freezing journey. Your egg freezing journey will begin with a fertility assessment. We'll review your medical history, check your hormone levels, and perform an internal ultrasound to get a clear picture of your fertility health.
My name's Emily Thomas and I'm a patient care executive at TFP Fertility. So we are the first people that normally our patients come to speak with throughout the journey, but especially during the initial points. So we'll book them in for their initial assessments and the consultation.
Your consultation offers a safe space for you to ask any questions you may have. Your specialist will review your results and provide a tailored treatment plan, giving you the confidence you need to move forward.
My name's James Hopkinson. I'm a consultant gynaecologist and TFP's medical lead. I've been working in the field of IVF for the last 30 years and have been running the unit here at TFP for the last 20 years. The journey starts with a consultation. We have to assess what treatment is right for that individual, to give them a realistic hope and expectation of what treatment will mean to them.
You will take hormone medication to stimulate your egg growth.
The IVF process, because that's what it is, it's a stimulation regime, takes only about a week and a half to 2 weeks to get to the point where we can collect eggs. In an IVF program where we want to freeze multiple eggs, we have to use stimulation drugs. These drugs are hormones that the pituitary gland produces naturally. It's called FSH, follicle stimulating hormone. The FSH is administered in a daily injection. These are subcutaneous, so injected under the skin, self-administered. They come in pens that you dial in the dose, much like a diabetic's pen or an EpiPen, which many people will have seen. When you're coming through for egg freezing, we use a course of injections that will stimulate the ovary and the small follicles within the ovary will grow. We have to monitor the growth of those follicles with ultrasound. It may be that you have 3 or 4 ultrasounds during the course of injections before you get to the point of the eggs being collected. This helps us to see how you respond. We can alter doses to increase the dose or decrease the dose if there's either over-response or under-response.
Following this, we'll book you in for your egg retrieval, a short procedure performed under mild sedation. Your eggs are frozen using advanced vitrification technology to preserve their quality.
The preparation before egg retrieval is very simple. It's when do you stop eating and drinking, going to the loo. There's nothing specific really that you have to do the morning of. So once your eggs are ready to be collected, the follicles look the right size, we'll plan to bring you into theatre. Theatre is sometimes a bit of a daunting place to go, but the team will welcome you in. You'll see the anaesthetist who will be looking after you through the egg retrieval process as you have the procedure.
So my name is Holly. I'm a pre-registrant embryologist. I've worked here for 12 years. I've really loved my job here.
So my name's Jo. I've been an embryologist since 2019, so 6 years. We'd start off by performing an egg collection, so we would look to collect eggs from the ovaries after some stimulation.
We pass a needle through the top of the vagina into the ovary. That's done under conscious sedation. It's not a general anaesthetic, but most people will not remember the process. An egg retrieval is an invasive procedure and you may have some discomfort afterwards. This is usually settled with simple analgesics like paracetamol and codeine. We always have staff on hand afterwards, on call if there are any problems. After the process, which takes about 10-15 minutes to do, you'll wake up in recovery with the recovery team who will look after you, give you a cup of tea, and you'll be home within an hour or two after the procedure.
And we then freeze them by a method known as vitrification, which involves storing them on very thin cryo stores, which then get stored in liquid nitrogen.
Your frozen eggs are safely stored in our state-of-the-art cryogenic chambers. They'll be there waiting for you when you're ready to use them.
We do get some people who have come in and who have sort of been through it a bit before, and they come to us just wanting a bit more support, and we guide them through that. We also get people who have just even started thinking about it, and they're normally very overwhelmed with everything. There's a lot of information out there, and our job is to break it down for them step by step and just make it more manageable. Our job is almost to be the guiding light, and from there they'll have a step-by-step process and they will know where they're moving forward to next. If you don't have all the answers today, that's okay. Egg freezing gives you those opportunities for tomorrow, and we're here at TFP to help you and keep those doors open for you.
Egg freezing doesn't have to be a last resort. Take control of your future with our flexible payment options, including a 0% interest finance plan with Access Fertility to help you spread the cost. If you're considering egg freezing, we're here to help support you every step of the way. TFP Fertility has been helping people build families for over 35 years. Now we're here to help you protect your future.